2026 Mental Health Assessment Practice Review. Question 1. Which of the following medications is commonly used to treat attention deficit/hyperactivity disorder, ADHD? Option A, haloperidol. Option B, fluoxetine. Option C, methylphenidate. Option D, clozapine. The correct answer is option C, methylphenidate. Methylphenidate is a central nervous system stimulant commonly used in the treatment of ADHD. It helps improve focus, attention, and impulse control in individuals with ADHD. Haloperidol and clozapine are. Question 2. Which of the following is a common side effect of electroconvulsive therapy, ECT? Option A, memory loss. Option B, weight gain. Option C, insomnia. Option D, increased appetite. The correct answer is option A, memory loss. Memory loss, particularly short-term memory loss, is a common side effect of electroconvulsive therapy, ECT. ECT can affect memory due to its impact on brain function during and after treatment. While the memory. Question 3. A patient with major depressive disorder is started on venlafaxine. Which class of antidepressant does this medication belong to? Option A, selective serotonin reuptake inhibitors, SSRIs. Option B, tricyclic antidepressants, TAS. Option C, monoamine oxidase inhibitors, MAOIs. Option D, serotonin norepinephrine reuptake inhibitors, SNRIs. The correct answer is option D, serotonin norepinephrine reuptake inhibitors, SNRIs. Venlafaxine is classified as a serotonin norepinephrine reuptake inhibitor, SNRI. SNRIs work by increasing the levels of both serotonin and norepinephrine in the brain, which helps alleviate symptoms of depression. Question 4. Which medication is typically prescribed for the treatment of attention deficit/hyperactivity disorder, ADHD? Option A, haloperidol. Option B, sertraline. Option C, methylphenidate. Option D, clozapine. The correct answer is option C, methylphenidate. Methylphenidate is a central nervous system stimulant often prescribed to manage symptoms of ADHD. It works by increasing the activity of certain neurotransmitters in the brain, helping to improve focus, attention. Question 5. In a patient with schizophrenia, which of the following symptoms would indicate a poor prognosis? Option A, auditory hallucinations. Option B, paranoia. Option C, flat affect. Option D, delusions of grandeur. The correct answer is option C, flat affect. A flat affect, characterized by a lack of emotional expression, is often linked to a poorer prognosis in schizophrenia. It can hinder social interactions and affect the individual's ability to engage in therapy or. Question 6. Which of the following would be the most appropriate intervention for a patient experiencing severe anxiety? Option A, encourage the patient to talk about their feelings. Option B, use a firm, authoritative approach. Option C, stay with the patient and provide a quiet environment. Option D, suggest the patient watch TV to distract themselves. The correct answer is option C, stay with the patient and provide a quiet environment. During a severe anxiety episode, it's crucial to stay with the patient and create a quiet environment. This approach helps reduce anxiety by providing a sense of safety and support, encouraging the patient to talk. Question 7. For a patient with obsessive-compulsive disorder, OCD, who spends several hours a day washing her hands, which type of therapy is most appropriate? Option A, exposure and response prevention. Option B, dialectical behavior therapy. Option C, family therapy. Option D, interpersonal therapy. The correct answer is option A, exposure and response prevention. Exposure and response prevention (ERP) is the most appropriate therapy for managing OCD. ERP involves exposing the patient to anxiety-provoking stimuli such as touching dirty objects and preventing the compulsive. Question 8. Kyle, a patient with schizophrenia, began taking the first-generation antipsychotic haloperidol, Haldol, last week. One day you find him sitting very stiffly and not moving. He is diaphoretic, and when you ask if he is okay, he seems unable to respond verbally. His vital signs are BP 170/100, P 110, T 104.2 a degree F. What is the priority nursing intervention? Select one that does not apply. Option A, hold his medication and contact his prescriber. Option B, wipe him with a washcloth wet with cold water or alcohol. Option C, administer a medication such as benztropine to correct this dystonic reaction. Option D, reassure him that although there is no treatment for his tardive dyskinesia, it will pass. The correct answer is option C, administer a medication such as benztropine to correct this dystonic reaction. The patient's symptoms, including stiffness, diaphoresis, inability to respond verbally, and vital sign abnormalities, are indicative of neuroleptic malignant syndrome (NMS), a serious and potentially. Question 9. Ted, a former executive, is now unemployed due to manic episodes at work. He was diagnosed with bipolar I 8 years ago. Ted has a history of 4 drug abuse, which resulted in hepatitis C. He is taking his lithium exactly as scheduled, a fact that both Ted's wife and his blood tests confirm. To reduce Ted's mania, the psychiatric nurse practitioner recommends Option A, clonazepam, Klonopin. Option B, fluoxetine, Prozac. Option C, electroconvulsive therapy, ECT. Option D, luridone, Latuda. The correct answer is option C, electroconvulsive therapy, ECT. Electroconvulsive therapy, ECT, can be an effective treatment for reducing mania in patients with bipolar disorder who have not responded to medication. In Ted's case, where he has a history of bipolar I disorder. Question 10. In a patient with bipolar disorder, which symptom would indicate a manic episode? Option A, excessive sleeping. Option B, low self-esteem. Option C, decreased need for sleep. Option D, anhedonia. The correct answer is option C, decreased need for sleep. The correct answer is C, decreased need for sleep. A decreased need for sleep is a hallmark symptom of a manic episode in bipolar disorder. During manic episodes, individuals may experience significantly reduced. Question 11. Which characteristic presents the greatest risk for injury to others in a patient diagnosed with schizophrenia? Option A, depersonalization. Option B, pressured speech. Option C, negative symptoms. Option D, paranoia. The correct answer is option D, paranoia. Paranoia in patients with schizophrenia can lead to aggressive behaviors, including violence, which poses a significant risk of injury to others. Individuals experiencing paranoia may perceive others as threats and. Question 12. Maggie, a child in protective custody, is found to have an imaginary friend, Holly. Her foster family shares this information with the nurse. The nurse teaches the family members about children who have suffered trauma and knows her teaching was effective when the foster mother states, Option A, I understand that imaginary friends are abnormal. Option B, I understand that imaginary friends are a maladaptive behavior. Option C, I understand that imaginary friends are a coping mechanism. Option D, I understand that we should tell the child that imaginary friends are unacceptable. The correct answer is option C, I understand that imaginary friends are a coping mechanism. Imaginary friends can serve as a coping mechanism for children, especially those who have experienced trauma. They can provide comfort and a sense of control in challenging situations, acknowledging and supporting. Question 13. Tomasz is a 21-year-old male with a recent diagnosis of schizophrenia. Tomasz's nurse recognizes that self-medicating with excessive alcohol is common in this disease and can co-occur along with Option A, generally good health despite the mental illness. Option B, an aversion to drinking fluids. Option C, anxiety and depression. Option D, the ability to express his needs. The correct answer is option C, anxiety and depression. Individuals with schizophrenia often turn to excessive alcohol consumption as a way to manage symptoms of anxiety and depression. This maladaptive coping mechanism can exacerbate the challenges associated with. Question 14. To provide effective care for the patient diagnosed with schizophrenia, the nurse should frequently assess for which associated condition. Select one that doesn't apply. Option A, alcohol use disorder. Option B, major depressive disorder. Option C, stomach cancer. Option D, polydipsia. The correct answer is option C, stomach cancer. Schizophrenia is often associated with comorbid conditions such as alcohol use disorder, major depressive disorder, polydipsia, and metabolic syndrome. Stomach cancer is not a common associated condition with. Question 15. A patient with schizophrenia is prescribed risperidone. The nurse should monitor the patient for which common side effect of this medication? Option A, granulocytosis. Option B, weight gain. Option C, hair loss. Option D, hyperthyroidism. The correct answer is option B, weight gain. When a patient is prescribed risperidone, an atypical antipsychotic, the nurse should monitor for weight gain as it is a common side effect of this medication. Weight gain can occur due to metabolic changes and. Question 16. When providing care for 10-year-old Harper diagnosed with post-traumatic stress disorder, PTSD, which goals should be addressed initially? Option A, Harper will be able to identify feelings through the use of play therapy. Option B, Harper and her parents will have access to protective resources available through social services. Option C. Harper will demonstrate the effective use of relaxation techniques to restore a sense of control over disturbing thoughts. Option D. Harper and her parents will demonstrate an understanding of the personal human response to traumatic events. The correct answer is option C. Harper will demonstrate the effective use of relaxation techniques to restore a sense of control over disturbing thoughts. The initial goal when caring for a child with PTSD like Harper is to address restoring a sense of control over disturbing thoughts by teaching relaxation techniques. This approach helps the child manage their. Question 17. Which intervention is most appropriate for a patient with a phobia of flying? Option A. Exposure therapy. Option B. Cognitive restructuring. Option C. Medication management. Option D. Psychoeducation. The correct answer is option A. Exposure therapy. Exposure therapy is considered the most appropriate intervention for a patient with a phobia of flying. This therapeutic approach involves gradually exposing the individual to the feared stimulus, in this case. Question 18. During pregnancy, a woman is in a relationship with a male who routinely abuses her. Her unborn child may engage in high-risk behavior as a teen as a result of Option A. Maternal stress. Option B. Parental nurturing. Option C. Appropriate stress responses in the brain. Option D. Memories of the abuse. The correct answer is option A. Maternal stress. Maternal stress during pregnancy can have long-term effects on the child's behavior and stress responses. Research shows that exposure to high levels of stress hormones in the womb can influence the developing fetal. Question 19. A patient with major depressive disorder is being treated with electroconvulsive therapy (ECT). The nurse should monitor the patient for which common side effect? Option A. Memory loss. Option B. Hypertension. Option C. Weight gain. Option D. Hyperglycemia. The correct answer is option A. Memory loss. Memory loss, especially short-term memory loss, is a common side effect associated with electroconvulsive therapy (ECT). During ECT treatment, the electrical currents passed through the brain can disrupt short-term. Question 20. A patient with generalized anxiety disorder (GAD) is prescribed escitalopram. The nurse should educate the patient that the full therapeutic effect of this medication may take. Option A. 1 to 2 days. Option B. 1 to 2 weeks. Option C. 2 to 4 weeks. Option D. 6 to 8 weeks. The correct answer is option D. 6 to 8 weeks. Escitalopram, an SSRI used in treating generalized anxiety disorder, typically takes 6 to 8 weeks to achieve its full therapeutic effect. While some improvement may be noticed earlier, the maximum benefit is usually. Question 21. Which intervention should the nurse implement when caring for a patient demonstrating manic behavior? Select one that doesn't apply. Option A. Monitor the patient's vital signs frequently. Option B. Keep the patient distracted with group-oriented activities. Option C. Provide the patient with frequent milkshakes and protein drinks. Option D. Reduce the volume on the television and dim bright lights in the environment. The correct answer is option B. Keep the patient distracted with group-oriented activities. When caring for a patient demonstrating manic behavior, it is crucial to monitor vital signs frequently to ensure the patient's physical health is stable. Providing nutrition, such as milkshakes and protein drinks. Question 22. What information should the nurse provide in patient education for a patient prescribed sertraline for major depressive disorder? Option A. Take the medication with food. Option B. It may take several weeks to feel the full effect. Option C. Avoid consuming grapefruit while taking this medication. Option D. Regular blood tests are necessary to monitor levels. The correct answer is option B. It may take several weeks to feel the full effect. Patients prescribed sertraline for major depressive disorder should be educated that it may take several weeks before experiencing the full therapeutic effects of the medication. This delay in onset of action is. Question 23. When attempting to determine a teenager's mental health resilience, what assessment question should the nurse ask that is not applicable? Option A. How did you cope when your father deployed with the army for a year in Iraq? Option B. Who did you go to for advice while your father was away for a year in Iraq? Option C. How do you feel about talking to a mental health counselor? Option D. Why would you think that is a better option than meeting with me? The correct answer is option D. Why would you think that is a better option than meeting with me? Assessing a teenager's mental health resilience involves exploring coping mechanisms, support systems, and attitudes towards seeking help. Option D is not relevant to assessing resilience but rather focuses on the. Question 24. Which statement made by the patient demonstrates an understanding of the treatment of choice for patients managing the effects of traumatic events? Option A. I attend my therapy sessions regularly. Option B. Those intrusive memories are hidden for a reason and should stay hidden. Option C. Keeping busy is the key to achieving mental health. Option D. I've agreed to move in with my parents so I'll get the support I need. The correct answer is option A. I attend my therapy sessions regularly. Regular attendance at therapy sessions is a crucial aspect of the recommended treatment for managing the effects of traumatic events. Therapy provides a safe space for individuals to process their experiences. Question 25. Which therapeutic communication statement might a psychiatric mental health registered nurse use when a patient's nursing diagnosis is altered thought processes? Option A. I know you say you hear voices, but I cannot hear them. Option B. Stop listening to the voices, they are not real. Option C. You say you hear voices, what are they telling you? Option D. Please tell the voices to leave you alone for now. The correct answer is option C. You say you hear voices, what are they telling you? The correct answer is C. You say you hear voices, what are they telling you? Because it employs therapeutic communication techniques that validate the patient's experience while encouraging further